Welcome back, everyone. Well, when it comes to health issues, creating awareness is really important in a couple of ways. How's a community interconnected? What can you do to be proactive? What are the preventative measures that you would take to avoid some of the things that can really be avoided, that can be very detrimental to your health? Well, joining me today is an expert in the OBGYN field. It's Dr. Danielle Goertzen. Welcome, Danielle.
Thank you.
Very nice to have you here. And also joining us is Jen Leszyk, who is and I have to read this, Jen, Performance Improvement Director for the Hudson Headwaters Health Network. Welcome, Jen.
Yes, thank you.
Very nice to have you here. Obviously, as an OBGYN, you face, and every day, you face a lot of issues that women face in areas that, let's face it, you think about the common cold, right? You think about some of the common viruses that we get hit with every day. Mm-hmm. The adage that women think about other members of their family before they even think about themselves. And you must see a gamut of issues when women come in that you're glad to raise awareness for them, but in a lot of ways I bet you wish you could have helped them prevent it as well.
Exactly. There are a lot of things that we can do for our health that could reduce future risk. Prevention is key, so getting the word out there is really important.
Now, when it comes to cervical cancer, right, I think you were telling me before we went on air, it was the leading cause of death in women. It's now third on the list. Not that that's a great place to be, but there are advances being made. And a lot of that has to do with testing and preventive measures, right?
Correct.
Give us an example. Let's say you're a young woman, say you're in your 20s. What would you recommend?
I would want a 21-year-old woman to come see her OBGYN or primary care provider to start her routine pap smear screening. Right. The pap smear is a screening test that can pick up abnormalities, so we could treat that before it ever turned into cervical cancer.
Right. Now, pap smears over the years have changed quite a bit, right? Technology always taking hold at some point or another, right? So the pap smear that I heard that my mother took way back when, right, is very different than the one now. You can actually do DNA testing, which then opens the door to discovering other abnormalities should they exist, right?
Correct.
Okay.
We have the ability now to test for HPV, which is the human papillomavirus. Mm-hmm. Through studies, we've now realized that's the source of almost 100% of cervical cancers. So by testing for the virus that causes that, we can be more fine-tuned with our testing and treatment for people who are at risk.
Gotcha. Now, I know a number of you out there did the same thing I just did. HPV virus, I've never heard of it. You're in for a surprise, right? Explain to us what this virus is.
So human papillomavirus is the most common sexually transmitted infection worldwide. Close to 90% of men and women will be exposed, usually in the late teens or early 20s, with sexual activity. Most of us will get rid of the virus, just like we get rid of the common cold, but a subset of people will be at risk for issues such as cervical cancer.
And as you were saying, I think that you were making the connection right between the virus and symptoms or early stages of cervical cancer, right? That the virus can play a role in that?
The virus is one of the causes of cervical cancer.
Wow.
And unfortunately, most women do not have symptoms until the disease process has spread. So we need to pick it up before it ever gets that far.
Now, considering the day and age we live in, of course, children, they're children to me now, but the children are becoming sexually active at a young age in their teenage years. Can you get vaccinated that young?
The vaccine is recommended to be given before sexual activity, so we are targeting the 11 and 12-year-olds. And the pediatricians have done an amazing job educating the parents and boys and girls about the availability of the vaccine. Our vaccine rates, in my opinion, however, are too low.
Yes, right, sure. Okay, well, you're building awareness for it. And let's face it, I'm sure like many of you, I didn't even know what HPV is. I don't know what it is. Jen, in the role that you have at Hudson Headwaters, you're doing a lot to connect these patients to the services and the doctors that they need. And something stuck in my head before the interview. Immediately I thought, well, as a patient coming in, they might have questions about their medical insurance right? And those kinds of structural questions. But the one emotional question really sticks in my mind, fear, right? What do you see when people come in?
Patients they don't understand the process, so
Yeah.
they're fearful in what that's going to look like.
Now, you're with Hudson Headwater Health Network, but as part of the community, you work closely with the other institutions, like Glens Falls Hospital, correct? How does that work?
Well, when we identify a patient that has a need, we can bridge that gap for that patient and reach out to the cancer services programs. And if it's our patient, we can walk them through that process. If it's for somebody in the community, we can make that connection for them.
Right, and that connection could be in a number of things. Something is that you wouldn't think of, right? Transportation.
Yes,
Right?
exactly.
Of all things. But the overriding factor here, and the reason that we invited them on, is that being proactive and helping prevent any, cancers. It's hard to even say the word sometimes. To prevent a cancer, that does involve screening. It does involve vaccinations. It does involve being proactive. If you have a child, an 11 or 12-year-old boy or girl, right, doctor?
Correct.
That get them vaccinated. If you're in your 20s, start the screening process for pap smears. Things show up, right?
And don't stop. Unfortunately, we see women who no longer seek OBGYN care when they're done childbearing, and 15 years later they have some abnormality and we realize it's cervical cancer because they haven't gone to the doctor for 15 years to have their pap smears.
Wow. Okay, well, I think the message is pretty clear. Really want to thank you both for coming in. I mean, at Hudson Headwater Health Network. Between your names and saying Hudson Headwater Health Network, I got my work cut out for me here. But what a wonderful organization that is. It's so involved in the community. We cover a lot of stories, and your John Riggy's been on for interviews and things. And really, what an incredible organization. And you're part of that organization, and both of you working together for the benefit of the patient, reaching out to the community and finding out where the pieces fit, all to make certain that that patient gets the best care that they can get. That's really something. So, very nice to meet you both.
Thank you for having us.
Very nice to have you in. To see this interview again, you can head to our website, looktvonline.com.